Since its elevation to an autonomous health body 2 years ago, the Africa Center for Disease Control says that it is still struggling to convince manufacturers to supply African countries with Mpox vaccines. Mpox is a zoonotic disease that jumps from animals to human and is endemic in many parts of or many countries in West and Central Africa. In a wide-ranging interview, Dr. Jean Kaseya, who's the head of the regional body, told the BBC that negotiations are still ongoing 1 year later to ensure that there will not be an interrupted supply chain when vaccines are shipped to African countries. I spoke to him and asked him how he plans to ensure that Western scientists and researchers oblige to global health treaties on sharing vaccine technologies.
This is something we are fighting also in Africa CDC. We don't accept and will never accept again to see Western countries coming to Africa, collecting pathogens, going back, making medicines without sending back that. This is one of the components we are discussing under the pandemic agreement. If you come to our continent, you collect pathogens, you make medicines and vaccines, you need to send us back a percentage of that. Regarding Mpox, they did it. They collected our pathogens, but to share back the vaccines and medicines, it became an issue.
So how soon should countries be able to expect these vaccines?
These vaccines, we can have it even from tomorrow. But what we want to have is a sustainable supply chain management. We don't want to have a one-time delivery, and then we are stuck because we cannot continue.
And speaking of vaccines, if we remember during the COVID-19 pandemic, African countries had to wait to be the last in line to get the much-awaited COVID-19 vaccines. The Africa CDC did push international pharmaceutical companies to be able to have producing plants in African countries. How is that going, considering the fact that Aspen pulled out in South Africa and Moderna did the same in Kenya?
You know, I have to call the agenda of local manufacturing as the second independence of Africa. We have only 1% of our vaccines coming from Africa, less than 5% of diagnostics coming from Africa, less than 20% of medicines coming from Africa. How do you want us to secure our future? How do you want us to build our health systems without commodities? This is why local manufacturing is, for me, an agenda for health security, economic growth, job creation, and peace and security. We have financing component because to manufacture, you need money. And we managed to work with Afrexim Bank, with other European Union, with World Bank.